Hey everybody, welcome back to OrthoNugs. In this video, I'm going to be demonstrating a patellofemoral taping technique using Leuko tape. It is a medial glide, medial tilt, and I've had good success with this technique. I typically use it initially as a test retest. So I will have the patient who is presenting with patellofemoral signs and symptoms to do something like a step up or a mini squat or transfer sit to stand, just something that they're reporting is provoking their anterior knee pain. Then I will apply this taping technique and then have them retry that activity. And what I found that is if this technique is going to work, we'll almost immediately have some degree of decreased anterior knee pain. So it's always in my bag of tricks as an option, and anybody who you see in your clinic who presents with signs and symptoms of patellofemoral syndrome, I would absolutely try this technique. Again, I'm going to be doing a medial glide, medial tilt, but I will also, if that doesn't work, and this is based on some research that was published several years ago, if that doesn't work, then I'll try a lateral glide and lateral tilt to see if that provides that immediate relief in symptoms. So anyway, worth a shot. Have a look and let me know if you have any questions. Thanks. All right, we've got our patient in supine or long sitting. I've applied this tough skin adhesive spray to the anterior part of the knee. I'm identifying the borders of the patella. I like to have about 1.5 to 2-inch anchor on the lateral or the area just lateral to the lateral patellar border to anchor the tape and then apply that medial glide. So this is Hypafix, just this pre-tape to protect the skin from the very tacky Leuko tape that we'll be applying. Again, you can see there's a fairly short anchor on the lateral side. We're just gonna need enough to apply the Leuko tape and then pull medially. So much more tape applied on the medial knee than on the lateral. Then we're gonna grab the Leuko tape and again, identifying the lateral border of the patella, apply the anchor. So as we're pulling that tape tight, I'm also going to apply a medially directed glide with my thumb. We'll apply a second piece of Leuko tape here. Again, medial glide, pulling the tape. You can see the skin bunch up a bit. I like to see that, just to know that my medial glide was adequate. And then we'll take a bisecting line, a sagittal bisecting line. We'll apply force on the medial aspect of the patella for that medial tilt, and then apply the Leuko tape. Now, I mentioned using this technique as a diagnostic tool as well. So some sort of functional motion that provokes pain, tape, and then retape. And this should immediately decrease symptoms. I also mentioned in my intro about doing a lateral glide and tilt. I know that goes against everything that many students are taught about lateral displacement of the patella, creating patellofemoral symptoms. But there's an oldie but goodie study that was published, I said several years ago in the intro. It's probably, I don't know, 15 or 20 years old at this point in the Journal of Orthopaedic and Sports Physical Therapy. In that article, they found that both medial gliding and lateral gliding of the patella with taping both decreased symptoms in individuals with patellofemoral syndrome. So my go-to is medial glide tilt. I want to see that immediate relief in symptoms. If I do not, then I will trial a lateral glide tilt as well. And again, that's